of global experts, policymakers, researchers, community advocates, partners, and leaders who continue to shape the future of health on our continent. For more than 3 decades, this has been a platform for Africa to reflect, confront hard truths, share scientific breakthroughs, and reaffirm our resolve to end the public health threats posed by AIDS, TB, and malaria. The theme for Icasa 2025 speaks to the shifting global environment. Donor priorities are changing. Fiscal pressures are tightening. Health emergencies are testing our systems. And the space for global solidarity, though still important, is narrowing. Distinguished delegates, if Africa is to end AIDS, and I understand, I agree with you, we can end it, we must lead our own response. We must strengthen domestic financing, build regional pharmaceutical manufacturing capacity, enhance disease surveillance and laboratory systems, and empower communities and civil society organizations. Earlier this year, Ghana convened the Africa Health Sovereignty Summit to chart a new path for sustainable financing, domestic manufacturing, and resilience. The message was clear. Africa cannot outsource her health security.
Historically, Ghana's HIV response has been financed through a combination of domestic resources and support from development partners. However, recent development poses a significant threat to this balance. The withdrawal of USAID's support for the procurement and distribution of antiretroviral medicines had the potential to create serious vulnerabilities in our supply chain, particularly in districts that rely heavily on USAID for consistent ARV availability. This withdrawal risks creating delivery gaps, stockouts, and increased pressure on our domestic health budget. Had these vulnerabilities materialized, they would have jeopardized continuity of care, threatened viral suppression gains, and increased the risk of drug resistance. These vulnerabilities were averted because President Mahama took bold, swift, and decisive decision, directing the Minister for Finance to immediately allocate domestic resources to cover the emerging funding gaps. This intervention ensured uninterrupted ARV supply nationwide and protected the integrity of Ghana's treatment program. Building on this decisive response, Ghana is now advancing through critical reforms, rationalizing the National HIV and AIDS Fund to provide dedicated, practicable domestic financing for treatment, prevention, and community procurement.
We are only 19% of the world's population here in Africa, but we make up 65% of the total number of people living with HIV globally. More than half of the people waiting for treatment live here on this continent. More than half of all the new infections every year happen here in Africa. Yet we have the science, the tools, the knowledge that's needed to end AIDS. AIDS is no longer a medical challenge. Ending AIDS is a political choice. Here are the 3 choices we as African leaders can make to get us there. 1, we can choose to resource the HIV response adequately. 2, we can choose to protect the rights of our people so that they can access safely HIV services that they need.
Every 2 years. This is one of those 2 years. And we selected Ghana for the reasons that have been mentioned. We're very proud of Ghana. We're based here in Ghana. We believe that Ghana will harness the West African communities. We think that Ghana is doing well in its health systems. We believe also that we are fighting HIV in a very, very forthright manner. And I want to thank you so much, Minister.
This Icasa is actually calling African leaders, the whole Africa, to prepare for the West and also to sustain the HIV response. Donors have been doing it, like Global Fund, PEPFAR, and now it is time for us as Africa to take our response, because looking at the statistics, the young generation in Africa are getting more infected. About 1/3 of the population, the world population on HIV is from sub-Saharan Africa, and of that, about 30% of them are young people living with HIV. And Africa and Ghana is part of it. And so it is time to prepare and create a future for our young people. It's also calling for political leadership. It shouldn't be rhetoric. Talking about it is not the way to go. We want to see actions, and we want to see global solidarity in Africa taking responsibility of the HIV response.
We have been confronted with these 3 diseases for over a decade, and then we've always relied on international partners' support, especially Global Fund. So having the opportunity to host this year's Icasa means that we are bringing on board African partners and global leaders, together with our political leaders, to prioritize HIV, TB, and then malaria. And in doing this, what we seek to achieve is to address the issue of bringing finality to the death of AIDS, and then also reducing new infections among HIV clients and then people in Ghana.
The conference is for showcasing what we are doing in the HIV world and the new innovations that are upcoming and those that are here with us. And we learn how to adapt the smart practices of other countries. So having it here is very significant. We are learning from our colleagues from Africa. We've come together as Africans, and as the team says, Africa in action. We are moving forward. We want to end AIDS in Africa. Unfortunately, 2030 is just around the corner, and we have to intensify our efforts to end HIV and AIDS in Ghana.